Ebola virus disease among children in West Africa. Ebola virus disease among children in West Africa. The epidemic of Ebola virus disease (EBV) in West Africa has caused clinical illness and then death among persons with reported ages ranging from less than 1 year to more than 100 years. Here we investigated the progression and outcome of ABE in confirming and probable pediatric cases reported from Guinea, Liberia, and Sierra Leone, stratified according to age.
Ebola is a highly contagious and often deadly virus. People suffering from the disease are only infectious once they develop symptoms. These symptoms appear between 2 and 21 days after infection, usually from 8 to 10 days. The virus targets the body's immune cells. These usually act as a first line of defense, catching and digesting infections. Normally, the immune system is able to boost its defenses to fight off an attack, but the Ebola virus manages to defeat and even destroy immune cells, often ultimately leading to death. Early Ebola symptoms include sudden fever, a general feeling of weakness, muscular pain, headaches, and a sore throat. The virus then attacks and damages cells protecting the blood vessels. This causes bleeding, dehydration, and abnormally low blood pressure. The liver is an organ where the virus can develop quickly, meaning patients often suffer from stomach pain, diarrhea, and vomiting. Some people also experience reddening of the eyes, rashes, hiccups, difficulties breathing and swallowing, internal and external bleeding to death.
Symptoms of Ebola. The main symptoms of Ebola are sudden fever that can reach 39 5 degrees, with spread and intense fatigue, headache and sore throat, vomiting and diarrhea occurring between 1 and 2 days after the above symptoms. Application in nursing. Contact precaution and airborne. First contact with the health system surgeon mask. Practice universal infection control. Hands before and after patient contact. Location in a restricted area, at home or health center. Oxygen via nasal catheter. Fluid and electrolyte balance. Tone, circulatory volume and blood pressure. Contraindicates intramuscular injections, aspirin, sites and anticoagulants. In the hospital setting, did not take samples of body fluids. The epidemiology service as quick as possible. 112 or PC doctor.
As the Ebola virus continues to ravage the West African nations of Guinea, Liberia, and Sierra Leone, affected communities are grappling with one potentially unforeseen consequence: orphans. The United Nations Children's Fund estimates nearly 4,000 children have lost one or both parents to the Ebola virus. Yvette Stevens is Sierra Leone's ambassador to the United Nations office in Geneva. She said Ebola orphans present a unique challenge.
Normally, in an African society, often children would have relatives, would have foster parents. But I think what some of the problems we're facing now is that some of these orphan children, people are afraid to keep them because they say your parents died of Ebola. They're afraid that they might also have the disease. So that is a problem. And increasingly, the whole idea of orphanages would have to be considered in terms of looking after these children.
Michael Stolman is a regional information officer for Catholic Relief Services in West and Central Africa. He echoed Ambassador Stevens' observations. Stolman told Catholic News Agency that many children who have lost their parents to Ebola face stigma and rejection in their communities and even in their extended families. Catholic Relief Services has plans to launch a trauma healing project for Ebola orphans in Sierra Leone. Stolman said Ebola survivors will play a crucial role in caring for Ebola orphans. Ebola survivors are immune to the virus, so they can work with Ebola orphans without fear of contracting the disease.
Ebola is one of the deadliest viruses known to man. It's named after a small river in the Democratic Republic of Congo where it first emerged in 1976. Up to 90% of infected individuals die from the virus. The African fruit bat is considered a natural carrier of the infection. Gorillas, chimps, monkeys, antelope and porcupines are also susceptible to catching and spreading the disease. There are several strains of Ebola: Zaire, Sudan, Bundibunjo, Reston and Thai forest. They're spread through contact with the blood, body fluids and tissues of an infected person. Researchers say airborne transmission may also be possible. After an incubation period of between 2 and 21 days, symptoms include severe fever, weakness, muscle pain, headaches, and a sore throat. This generally develops into vomiting, diarrhea, rash, impaired kidney and liver function, and sometimes internal and external bleeding to death. The Ebola virus multiplies quickly, overwhelming the immune system to fight the infection. No medicine or vaccine currently exists.
The outbreak began in southeastern Guinea in March. Since then, it has spread to neighboring Sierra Leone and Liberia, with 814 confirmed cases across 3 countries. The Ebola virus is transmitted through bodily fluids, via oral and nasal exposure, and through the conjunctiva. The virus infects and replicates in immune cells, which further disseminate the virus. Lymphocyte depletion and necrosis are observed in the spleen, thymus, and liver. Intensified immune response leads to dysregulated coagulation, which causes bleeding and hemorrhaging in the gastrointestinal tract. Compromised vascular and endothelial cells also cause blood vessel leakage, leading to hypotension. Dysregulated host immune response, coagulation abnormalities, and an impaired vascular system lead to shock and systemic organ failure. Doctors are at high risk of exposure to the virus. They must apply additional infection control precautions, including wearing personal protective equipment such as gowns, masks, gloves, and goggles, as well as ensuring complete equipment sterilization. Ebola patients must be isolated and attended by medical staff who have been trained in infection control measures.
Pro. The advantage we have with Ebola is that it has a very short incubation period, though which means that patients cannot recognize perfectly. Cons. The disadvantage is the high mortality have and that even the bodies might be contagious. Conclusions. Ebola is very aggressive to have high fatality rate and ignoring its effective treatment also leaving serious consequences for the population, though still relevant monitoring and kind of similar to the Ebola disease.